Hey, it's Dr. Karen with this week's Hot Topic. Make sure you like this video, subscribe to our YouTube channel, and follow us on social media so you never miss another hot topic. So today I want to talk to you about sleep bruxism. So what is this sleep bruxism if you've never heard of it? So basically it's just teeth grinding that happens during your sleep. So sleep bruxism and regular bruxism can happen, they're the same thing, but basically one's awake and one's different even though the physical action is very similar. So of the two, awake bruxism is more common, but today we're going to talk about the sleep one. So what are the symptoms of sleep bruxism? So basically the main symptom is involuntary clenching or grinding of your teeth during sleep. So it has to be sleep, that's kind of the main thing. So the movements resemble chewing, but they're generally involve a little bit more force. And people with sleep bruxism don't necessarily grind their teeth throughout the night. Instead, they have these episodes of clenching and grinding. So people can have very few of them, but some people even have more, up to like 100 a night. So the frequency of episodes is often inconsistent, and this teeth grinding may not occur every night. So some of this amount of motion is normal during sleep, but really up to 60% of people make occasional chewing and motions, which is more of like the rhythmic masculatory muscle activities. But with people who have the sleep bruxism, it occurs more frequently and more force. So that's really kind of the key with all this. So the majority of sleep bruxism takes typically in the early stages of sleep. So it's between like 1 and 2 of the non-REM sleep cycles. So a small percentage of episodes can arise during the REM sleep, but typically not. And jaw pain and neck pain are two frequent signs of teeth grinding. So this occurs because the tightening of the muscles during the episodes of the bruxism, so those morning headaches that feel like tension headaches, are another potential symptom. So unexplained damage to teeth can also be a sign of nighttime clenching and grinding your teeth. So now that you know these symptoms and what it is, what actually causes this sleep bruxism? So there's multiple factors influence the risk of sleep bruxism, and sometimes it's not entirely possible to identify just one single cause for people why they clench their teeth. However, there are some risk factors that are associated that have a greater possibility of having sleep bruxism. So stress is the most significant of these factors. You probably figured that out. But clenching your teeth when facing negative situations is a very common reaction, and that can carry over into episodes of sleep bruxism. So teeth grinding is also believed to be connected to higher levels of anxiety. So episodes of teeth grinding appear to be connected to changing sleep patterns or having those little patterns or micro arousals from sleep. Now, most teeth grinding is preceded by increases of brain and cardiovascular activity. So that's also why it explains the associations between the sleep bruxism and sleep apnea. So I've mentioned this before, which again, those are those minor interruptions of lapses in breathing while you're sleeping. So it's constantly waking you up. So if you find that you have these things, what are some treatments for it? So now there's no treatment that can completely eliminate or cure these teeth grinding during sleep, but there are some approaches that you can take that decreases the episodes and can limit the damage to your teeth and your jaw. So the first one, because stress is the most common, it's stress reduction. So high levels of stress contribute to the bruxism, both awake and sleep. So taking steps to manage and reduce your stress naturally can help protect your teeth. So reduce the exposure to stressful situations, of course, is ideal, but sometimes it's just impossible to decrease that stress. So combining negative response to stress in order to reduce its impact. So just being aware of it. So mouthpieces is another one. So you can do a lot of different mouthpieces or mouth guards at night. They typically call them night guards. So it's used to reduce the damage to your teeth and mouth that can occur because of the bruxism. Dental splints can also cover the teeth, and it kind of act as a barrier. So if you're grinding your teeth, it's not going to really grind them down. Splints are often designed by dentists for a patient's mouth, but you can also get them over the counter, not quite as specific when you have a dentist with an implant. So sometimes it can cover just a section of your teeth, or it can do a whole area of your teeth, both the upper and the lower. Another thing that you can do is just symptom relief. So you can just treat the symptoms that can help people better cope with sleep bruxism. So avoid gum chewing, hard foods that cut down on painful motions of the jaw. You can use a hot compress on the sides of the side of the jaw to temporarily relieve some of that temporal pain. Facial exercises can also help reduce some of the pain in your face or jaw if you have sleep bruxism. Facial relaxation, a massage, their head and neck area can also help reduce some of this tension. And of course, last thing is you can get adjusted. Yes, chiropractors can adjust your TMJ, which can help relieve some of that tension you have when you're clenching your jaw. So if you're clenching your jaw a lot, you might find that you're, you might lock your jaw, those type of things. But getting your jaw and your neck adjusted are also going to be super helpful for you, especially if you are a sleep bruxism person. So that's all I have for you guys today. I will see you guys next week.